to DXB today, where this evening we're taking a bit of a deep dive into the expansion, the investment into, and the growth of not just the medical but also the health tourism sector right here in Dubai. And it's down to a number of great medical experts and of course experts in the field, and more so than our next guest, a distinguished leader in the field at the moment, dedicated to medical excellence across the region as a whole. Please welcome to DXB today Professor Abdel Rahman Ahmed Omer from Burjeel Holding. Professor, thanks for being with us.
Good evening. Thank you very much.
Kind of you to join us. I'm sure you've been listening on intently to the conversation thus far. So who better to ask to give us a sort of indication as to where the UAE is at the moment, in terms of the fact that there are so many choices for people to choose. If people are looking to cross borders for medical or health tourism, why would they choose the UAE? What sets it apart?
To start with now, there is a lot of things happening in the development of health services in UAE, from Dubai to the Abu Dhabi to the other areas. And this is specifically were set and targeted by a government plan. So health tourism is going to be one of the basic things that's going to be an attraction to the UAE in general and the region. So for that, the infrastructure was built well, the expertise were brought in, and it's almost, I can see that we are on the frontiers of knowledge and practice at the moment. Definitely, the cost was not an issue. Usually it's a challenge. So we got all the top class investigation methods and the doctors and the instruments. Also, what makes it very attractive, that the position and the placement of UAE in general, especially Dubai, with the airports, flights, like you're about 90% of the population of the world, about 6 hours away. So maybe more than that. So people do come here, as well as the welcoming atmosphere, the easiness to travel. People used to go to Western Europe, okay, at the beginning, and then the issues of visas and travel and all these strategic things became a challenge. So there's delay. I'm sick, I need to go see a doctor, and I need to see a good doctor in a good place. Then they shifted to Asia, Thailand and so on and so forth. But also the balance, the long distance from the area, the being in a culture that's totally different to them, brought them, try to find a new thing. So we came with this big offer for them, which is, to be honest, it is not only just provision of healthcare and sort of tourism. It's beyond that. There is a lot of areas that I can talk about, but mainly people like it here, easiness, coming here, and they don't feel foreigners. Because wherever you come from, in Dubai, where else? You into Chinese, you into Argentine, you can be Argentine, whatever you like.
Home from home.
Yeah, home from home. And also the communication, like the infrastructure for the telecommunications, for communication with people, it's amazing. And on top of that, when you feel better, you can have good fun.
Head to the beach straight after for your recovery.
Exactly. This is the whole idea of being well and extra well.
Professor Abdel, my question to you is, which of the countries do you think Dubai right now is currently competing with in terms of medical or health tourism? And another question to you is, what do you think are some of the most popular procedures for which a tourist would fly into the UAE to get a procedure done?
Yeah, I mean, like at the moment, being away from the Western world because of the expense now, because most of the people trying to move out, we're having a very, we are located in a very attractive place for Africa. And Africa have three categories of people. People who can afford things that's very expensive, and this used to go to the Western world, Europe and Northern America. But now, because the logistics is difficult for them, so they can find equal care and they come here to the UAE. And also some areas of Asia that we have strong links with them, diplomatically and geographically and economically. They start to discover UAE and discover the places here, and part of it is to see that how far we went in our provision of healthcare. Okay, I mean, the simplest thing you can see now, instead of used to have California smile, now we can see it in California saying Dubai smile. Right? It's just, if you go on holiday, you see big things like Dubai smile. So that's by itself is putting the place into its position. So the costs made them shift to Asia. But now here, especially as I represent Burjeel Holdings, we have what we call equity of care. We care for everybody at any level of income. So we can tailor it to your needs. The difference is not going to be the type of medical care you have. It is the atmosphere you have. So we have like 7-star hotels, right? That's a hospital. that definitely is going to cost more because of just the ambience and the sitting area and the services. While there are ones that we care for, even the blue collars. They don't have less health care, but the way we do it, it's a little bit cheaper. But anywhere you go, we'll give you a special experience because it's also the UAE hospitality.
Yes.
We are a hospitable nation, so welcome to UAE. That's a different, get well and go back.
Absolutely. And
Yeah.
you know, Doctor, when we talk about Burjeel, allow me to say that if you can elaborate more on the excellence centers, which we have, the excellence centers. And this is another attractive, and I believe, I don't know if you agree with me, it's a magnet which will make sure that you will be attached to that center even after your service, and you will be a good ambassador to show how and what is the quality of the healthcare service. Not only Burjeel, but Burjeel as an example. Can you elaborate on those centers?
Thank you for that. That's actually a very important point to state because this is what all Burjeel, the name, is about. Is grew up in the last decade and focus on certain areas. We brought, instead of it started was the local Emirati people used to fly abroad.
Yeah.
So why the patients go to the doctor? We brought the doctor to the patient.
Yes.
So we have certainly centers of excellence at international level, like Palis for the bones from Florida to Abu Dhabi and in Dubai. That's great. We have Cyprus for fetal medicine with amazing stories.
Indeed.
Recently we had a story with a girl from Colombia, which is like, wow, it's just amazing thing. They flew from Colombia here, they had the treatment and went back. Fetal medicine, very rare.
Yeah.
We have orthopedic surgery, we have maternal
Cancer.
endometriosis and oncology. We are the kings of oncology at the moment.
Indeed.
I can't say that.
Yes, we are. We
Yeah.
are. Yes.
Our cure rate is very high, our care is very high, patient satisfaction is extremely high. We have international experts at all levels and a mixture between people who brought from abroad and local talents. So this by itself is developing the whole thing together.
Yeah.
Because the exchange of information, exchange of attitude, and exchange of how we perceive patients and how you look after them. It's an amazing. Also, we augment that with our research programs,
Indeed.
okay, with
Yeah.
international things
And,
and
and
trials.
also the publication. This is another area where you are defining your service with an evidence base. And allow me here to mention Dr. Hamid Ashamsi, who is one of our star and who's doing great on the local level and international level on Burjeel platform.
I believe that Hamid, as a colleague
Indeed.
of mine, he's exceptional.
Indeed.
He's not like a normal doctor you meet every day. He's a special talent. He's extremely intelligent and dedicated. This is something that I usually don't like to say it in public to him. I don't want him to hear that from me, but the reality is we have a lot of respect for him.
Indeed.
It's not only the number of publications, it's the quality of publications.
Absolutely.
And there is also, because Hamid is a lovable person, like on the screen. You see him everywhere, right? We also have other things that he's got his finger in, and other colleagues of ours, like the trials, the publications. We have Lancet, we have Science, we have, I mean, like, it's level
Absolutely.
of world standards.
Doctor, can you, sorry, please.
Professor Abdul, please stay with us because now it's time for the daily roundup. Faris, what have you got for us?
Yes, indeed. I can tell you that the roundup today is, of course, about the UAE, which has become one of the world's fastest growing medical tourism destinations as travelers come to the Emirates for specialties such as dentistry, gynecology, and dermatology as well. Having the fastest growth rate for health spending in the GCC, the country is expected to reach $30.7 billion by the year 2027 due to the launch of several initiatives like the Emirates Health Services Innovation Strategy 2023 to 2026 and the National Strategy for Wellbeing 2031. Your Excellency, can you tell us a little bit about some of those initiatives? and what we can
Indeed.
expect from them?
One of the areas which I would like to highlight is the care for seniors. Right now in United Arab Emirates and Dubai, we are encouraging special packages for those people who are above 65. And that itself will have a very soft and constructive element where we'll make sure that the prevention is available, the intervention is available, and the rehabilitation is available. And one of the hottest areas as well right now is regenerative medicine. Everybody talks about a stem cell, about exosome, and so on. So United Arab Emirates, we are well known that we are always trying to come up with new legislation which supports such service and support the provider and the patient itself. So today we have Abu Dhabi Stem Cell Center, and only a month ago where they started providing an excellent, unique, international, global services for the people with multiple sclerosis. Usually these people go for a long journey with medication weekly base and complication, but right now with this available, affordable, cross the road, accessible services, you can minimize the risk of such disorder and prognosis by only combining the medication with a product of stem cell, which is available in United Arab Emirates, which is provided in United Arab Emirates, and on top of all, it's very well governed when it's come to the product, the quality, and the side effects.
What she just mentioned, Her Excellency, that as yet we succeeded with exceptional success that we could not even imagine, to put the Emirates in a position to be leaders.
A lot of this comes from investment from above, is that right? As well, investment into the infrastructure.
Yes, it's a holistic approach. It's well planned, seamless. I mean, like we have the stem cells, we have the bone marrow transplant, we have solid organ transplant, we have the research going, we have the education. We became like a hub for continuous medical education. It is a vision beyond vision, I say.
Yes. Professor Abdel, thank you so much for taking the time to come here. We appreciate your time.
Thank you very much.
And Dr. Mariam, please stay with us. We are not done with you. There's still so much we want to learn from you, so please hang in there. Coming up, we are discussing affordable medical treatments across the country with the founders of a leading medical tourism company. Plus, we've got music on set, so stay with us.